Inserting and removing nasogastric tubes. Preparation. 1. Assess for history of nasal surgery or deviated septum, patency of nares, presence of gag reflex, mental status or ability to cooperate with the procedure. 2. Determine the size of the tube to be inserted, whether the tube is to be attached to suction. 3. Assemble equipment and supplies. Large or small bore tube, non-allergenic adhesive tape 2.5 centimeters 1 inch wide, clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 milliliter syringe with an adapter, a basin, pH test strip or meter, bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug, optional, suction apparatus if required, safety pin and elastic band. Assist the client to a high Fowler's position if health condition permits and support head on a pillow. Place a towel or disposable pad across client's chest. Procedure. Introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Perform hand hygiene and observe other appropriate infection control procedures. Provide for client privacy.
Hello.
Hi.
My name is Gilbert. I'm going to be your OBN today. Before we start, what's your name?
Diana.
Diana? Alright, just check here. Alright, and your date of birth?
7/26/93.
Oh, excellent. Okay, what we're going to do today is a little procedure. We're going to be using the nasogastric tube.
What's that for?
What it is, it's a tube we're going to use. It's going to go down your nose and to your stomach, all the way down. And it's going to be a feeding, pretty much. We're going to put in a tube and start just like feeding you through the tube. Sounds pretty bad, gross, but it's something to get your nutrients and everything into your stomach so you can feel healthy and strong. Okay?
Okay.
Alright, so just give me a quick second. I'm going to give you some privacy and we'll go ahead and start with that, okay? Wash my hands real quick.
Assess the client's nares. Ask the client to hyperextend her head and using a flashlight observe the intactness of the tissues of the nostrils, including any irritations or abrasions. Examine the nares for any obstructions or deformities by asking the client to breathe through one nostril while occluding the other. Select the nostril that has a greater airflow. Prepare the tube. If a small bore tube is being used, ensure the stylet or guide wire is secured in position. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Insert the tube. Put on gloves. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve towards the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube towards the nasal pharynx. Direct the tube along the floor of the nostril and toward the ear on that side. Slight pressure is sometimes required to pass the tube into the nasal pharynx, and some clients' eyes may water at this point. Provide the client with tissues as needed. If tube meets resistance, withdraw it, relubricate it, and insert it in the other nostril. Once the tube reaches the oral pharynx, the throat, the client will feel the tube in the throat and may gag and retch. Ask the client to tilt the head forward and encourage the client to drink and swallow. If the client gags, stop passing the tube momentarily, have the client rest, take a few breaths, and take sips of water to calm the gag reflex. In cooperation with the client, pass the tube 5 to 10 centimeters, 2 to 4 inches, with each swallow until the indicated length is inserted. If the client continues to gag and the tube does not advance with each swallow, Withdraw it slightly and inspect the throat by looking through the mouth. Ascertain correct placement of the tube. Aspirate stomach contents and check the pH and/or bilirubin. Place a stethoscope over the client's epigastrum and inject 10 to 30 milliliters of air into the tube while listening for a whooshing sound. If the signs do not indicate placement in the stomach, advance the tube 5 centimeters, 2 inches, and repeat the tests. Secure the tube by taping it to the bridge of the client's nose. Attach the tube to a suction source or feeding apparatus as ordered, or clamp the end of the tubing. Secure the tube to the client's gown. Document relevant information. Establish a plan for providing daily nasogastric tube care. If suction is applied, ensure that the patency of both the nasogastric and suction tubes is maintained. Removing a nasogastric tube. Perform hand hygiene and observe other appropriate infection control procedures. Provide for client privacy. Detach the tube. Disconnect the nasogastric tube from the suction apparatus if present. Unpin the tube from the client's gown. Remove the adhesive tape securing the tube to the nose. Remove the nasogastric tube. Put on clean gloves. Optional, instill 50 milliliters of air into the tube. Ask the client to take a deep breath and to hold it. Pinch the tube with a gloved hand. Smoothly withdraw the tube. Place the tube in the plastic bag. Observe the intactness of the tube. Ensure client comfort. Provide mouth care if desired. Assist the client as required to blow nose. Dispose of the equipment appropriately. Place the pad, bag with tube, and gloves in the receptacle or designated by the agency. Document all relevant information. Record the removal of the tube, the amount of appearance of any drainage, if the tube was connected to suction, and any relevant assessments of the client.